The orders for the patient are fluid at 150 ml per hour and amoxicillin 250 milligrams IV in 100 ml normal saline per 15 minutes. The fluid ordered is 150 ml per 16 minutes times a drop factor of 15 per ml equals 37.5, but because we round up using drop factor, the drop factor for the fluid is 38 drops per minute. The medication fluid ordered is 100 ml per 15 minutes times a drop factor of 15 per ml equals a drop factor of 100 drops per minute. To administer the medication, I will verify the provider's orders and perform the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I'll verify the patient using 2 patient identifiers, perform patient privacy, I'll verify any patient allergies, and verify the information in the patient's chart. I'll then perform hand hygiene and apply clean gloves. Next, I'll review all the parts of the IV tubing. I have 2 sets. They are both macro tubing. Macro tubing typically delivers a 10 or 15 drop factor per ml, depending on the manufacturer. And it's used to deliver rates greater than 100 ml per hour. For my primary tubing, it is labeled a drop factor of 15. The components are the spike end. This connects the tubing to the fluid bag. A drip chamber, the site where the rate is counted. It delivers small volumes with the aid of gravity. A small volume of IV solution is placed in the chamber and regulated for administration. This is the roller clamp. It is used to adjust or stop the rate of flow. Right now it is fully closed, but I can roll it to be open, closing it all the way. This is the Y site. This is the port where medications can be administered, either push medications or a secondary line can be connected to it. And this is the adapter end. This is where it connects to the patient's IV catheter to allow fluid administration. This is the secondary set tubing. It is also labeled with a drop factor of 15 per ml. It comes with a hook, and its components are a spike end, drip chamber, roller clamp, and adapter end. We'll be using this secondary set to administer the piggyback medication via the Y port in the primary tubing. I have confirmed that this is the IV solution the patient will be receiving. I'll make sure that the roller clamp is fully closed to prevent any fluid flow. I'll remove the fluid container port cap and the spike end cap and insert the spike end fully into the port. Next, I will prime the tubing. I'll gently compress the drip chamber to fill halfway. Remove the adapter cap. And gently open the roller clamp to allow a few drips to go through. I notice an air bubble in my line. I will tap the IV line to remove the air bubble. There is no more air. There are no air bubbles. I'll now ensure that the IV container is at least 30 inches above the patient's IV site. The drop rate factor for the ordered fluid of 150 ml per hour was calculated to 38 drops per minute. I'll count for a full minute to ensure a 38 drop rate, using the roller clamp to adjust as needed. The drop rate is now at 38. I have confirmed that this is the ordered medication, amoxicillin, 250 milligrams in 100 ml normal saline with my secondary set. I'll prepare the hanger. I'll remove the medication fluid port bag cap and the spike end cap. Again, ensuring that the roller clamp is completely closed to prevent any fluid flow, and insert the spike end all the way in the port. Now I'll prime the tubing. Gently compressing the drip chamber to fill halfway. I'll remove the adapter cap. To allow a few drips to pass through. And slowly open the roller clamp. All air is removed. There are no air bubbles. I've now fully closed the clamp. I'll recap the adapter end. I want to hang the piggyback medication higher than the IV fluid tubing. Next, I'll take an alcohol swab and cleanse the wide port. Allowing it to fully dry. Then remove the cap from the piggyback medication tubing and insert the cannula tip of piggyback infusion tubing. The drop factor for the medication was calculated to 100 drops per minute. I'll count the drop rate for a full minute to ensure 100 drops per minute, using the roller clamp to adjust as needed. The flow rate is confirmed at 100 drops per minute. After ensuring that the medication fluid drop rate is 100 drops per minute and the IV fluid flow rate is 38 drops per minute, I can now connect the primary adapter to the primary adapter from the primary tubing to the patient's IV catheter. I'll assess the IV site to watch for any signs of redness, swelling, or discomfort. I'll make sure that the patient is comfortable to see if they need anything and make sure that the call light is within reach. Then I'll dispose of any trash appropriately. Remove my gloves. Dispose of these appropriately. Perform hand hygiene. Assess the IV after it's been completed, and document the procedure.